evening. My name is Dr. David Doman, and
Hello.
welcome to another edition of Housecall. What's new with dentistry? Find out more right now. My guest this evening is Dr. Robert Sanker, a noted prosthodontist here in Montgomery County. Robert, welcome to Housecall.
Hello, nice to see you.
Great to see you as well. So briefly tell our viewers about your professional background.
Well, okay. Well, first and foremost, I'm a dentist, so I've done all the regular training of a dentist. And then secondly, I've done specialty training, which is certified specialty training, 3 additional years of training in a university setting in an area called prosthodontics. Most patients haven't heard of a prosthodontist because we are a relatively small group of specialists. Most patients don't know there are 9 areas of dental specialty. But prosthodontists treat patients of all ages, but are more experienced with problems involving tooth replacement, such as crowns, bridges, dentures, dental implants, bite problems, cosmetic problems, congenital problems. But in general, prosthodontists get called upon to handle probably the most difficult cases. So more complex cases that involve multiple specialty areas. So
how interesting. As you said, most viewers are unaware of the other subspecialties that have evolved in the field of dentistry. Can you briefly share with our viewers some examples of other dental subspecialties?
Yeah, absolutely. Most patients know of their orthodontist, who is a dentist, but then is also a trained specialist. Some patients, unfortunately, know who their endodontist is because they've had a root canal, or a gum specialist, a periodontist, or an oral and maxillofacial surgeon if they've had their wisdom teeth removed. So those are some of the specialty areas. There are also oral pathology and oral radiology and public health are considered dental specialty areas. And these are all established by the American Dental Association. And as certified specialty areas rather than just specialty areas that someone else just put a name on, so.
How interesting. So let's open with a very, very important topic, and that is oral cancer. How common is oral cancer in your specialty and for that matter, the dental community nationally?
Well, that's a great question because, I wouldn't say oral cancer is an epidemic, but there's certainly a lot more awareness today about oral cancer. Traditionally, we think of oral cancer in those patients that are heavy smokers, tobacco chewers, chronic alcohol users, but that has sort of, that still exists, but now there's a lot more focus on oral cancer because we know that it's linked to the human papilloma virus or HPV virus, which is sexually transmitted. So oral cancer is being diagnosed in much younger patients and patients that have no connection to smoking or tobacco chewing or alcohol. But most people today are aware that there is a vaccine for HPV, which is given to most children, starting at the age of about 12. So that's quite an issue.
So is it now the standard of care that whenever patients come to see you or other dental specialists, that they get a good oral exam besides checking their teeth?
Oh, absolutely. Every time we see a patient, we are doing a full oral exam under their tongue, their throat, And our hygienist as well is well trained in checking for oral cancer. That's part of her routine. So it's definitely important. We're seeing, because we're seeing younger patients now with problems. But it's not, I don't want to scare people, but it's not an epidemic, but it's there. So it's a reason to be having regular dental visits.
Let's go on then to shift to another important common topic, and that is silver fillings, amalgams.
Yes.
They were, I understand, dispensed with a number of years ago.
Yeah.
But tell our viewers about the history of dental fillings and what is the significance of having silver fillings in your mouth at this time?
Sure. Well, they weren't actually dispensed with, silver amalgam fillings. Sometimes you hear amalgam fillings called mercury fillings because the silver amalgam fillings are compounded with mercury. They're not banned from use. Now, of course, in some European countries, it is banned. But the American Dental Association has not banned the use of amalgam. But most patients, say over the 40s, over the age of 40, have some amalgams in their mouth because amalgam was a very common material, very commonly used in dentistry. Now, recently, not just recently, I'd say since the 1980s, the use of amalgam has waned for several reasons. One is more people are cosmetically conscious, and they don't want silver materials in their mouth, as well as the fact that newer materials have come onto the scene, resin composites and adhesive type materials that are replacing the use of amalgam. So in general, amalgam is still used in the US because it is a very cost-effective material. And that's important for a lot of patients, a lot of areas of the country. I personally do not use amalgam material, but I don't promote the regular removal of it. Some patients want to know if they should have their amalgams just removed because they're afraid of health concerns. And there are some advertising out in the public where dentists have advertised to say to patients, these amalgam fillings may be causing your MS or some other chronic illness. And that is not, the American Dental Association doesn't promote that. And I don't promote that as well. But in general, I'm not using amalgam material. And I'm hoping that it gets phased out over time.
In the so-called silver fillings, how much mercury is in there? And is there that leaching out into the body provide any risk for the patient?
Well, from the studies that I have seen, no, the answer is no, but there's a lot of discussion about it. So I really would have to say, I don't know the answer to that. That's why for the last 20 years, I haven't used amalgam because it's definitely a question. It's, years ago, 20, 30 years ago, we didn't think of mercury in too big of a sense. But nowadays, if there's a mercury spill in a school, well, it's like a major hazmat situation. So I'm cautious of it. I can't answer. I don't know the research. I'm not that connected to the research, but I prefer to stay clear of it.
Of course. Let's go on to discuss then a very important topic, which is cavities. As you know, our water years ago became fluorinated, and it was the hope that would greatly reduce cavities, and it has to a great extent. And yet, you're still, as a professional, seeing patients with cavities. Why is that?
Well, that's a great question also. I'd say a lot of patients, a lot of the public believes that you only get cavities when you're a child. And that's simply not true. You know, today, you know, we're really living in a polypharmacy world. You know, most adult patients are taking so many different medications. And if we look at the fine print on our medications, there's a syndrome called xerostomia, which refers to dry mouth. So now dry mouth is changing the flora of our mouths, and is creating a lot more plaque in our mouths, and it's just changing the flora. And we're seeing an enormous amount of decay in adult patients, and it's a huge problem. And that's why we still do promote the use of fluoride in different fashions. You know, although fluoride's in the water, we promote the use of fluoride in prescription pastes and things like that. But I am, in my practice, because it's primarily an adult practice, I'm seeing an enormous amount of adult decay. So there's quite a lot of education that is required to help patients with this.
A couple of years ago, I saw an announcement during the news that there was a professional health association that was challenging the validity of regular flossing. It practically knocked me off my seat. So what is your thoughts about regular flossing for dental health?
I think it's a good, flossing is definitely beneficial. You know, it's a way to an aid to removing we're trying to control, basically we're trying to control a biofilm. You know, that's what we have in our mouths. If we have a lot of crowns and bridges and dental implants, we're combating a biofilm, and floss is a good way of handling that. Now, that's not the only tool. You know, as you know, some patients have difficulty with manual dexterity, and so really for all adult patients, we try to tailor their care. You know, may not be flossing, might be something else, water picking, it might be some other method that they can manage. You know, so there's a lot of education there for patients that to personalize their approach to handling that.
We're going to pause briefly for a public service announcement.
All right.
More with my guest, Dr. Robert Sanker, dental specialist in prosthodontics. We'll be right back.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for healthcare and other resources. Call 211 or visit 211.org.
We're back. My guest this evening is Dr. Robert Sanker, noted dentist and specialist in prosthodontics. Robert, well, I want to shift gears now to discuss an important other topic, dental implants. When do you think it's appropriate for someone to be considered for dental implants?
What do I feel is appropriate? You mean how
a candidate?
Candidate. Well, certainly not every patient is a candidate for dental implants, but you know, it really involves a careful evaluation of each patient. You know, not only their health status, you know, their general health status is important to evaluate. But after that, you know, in terms of evaluating their bone and gum structure, it really shouldn't be just a flippant decision to, you know, having a tooth removed and putting a dental implant in. And a good thing is it's becoming more of a thoroughly analyzed thing. In my practice and in my colleagues' practice, you know, we have a lot of terrific technology to evaluate patients. We have CT scanning, and we have digital radiography, and many technologies to really carefully evaluate a patient to determine where the nerve is and so forth. So it's not, you know, it's not every patient is a candidate, but it's certainly something that should be looked at for a patient that is going to lose tooth, if they have a failing tooth, it should be considered.
Do you think that implants should be considered not just for a failing tooth, as you said, or do you think there's a role for somebody purely for cosmetic reasons to replace their entire mouth of teeth with implants?
Well, if I'm understanding your question, certainly we don't want to take out good teeth and put in dental implants. We want to have very good reason to take out teeth still. It's still not to the point where a dental implant is better than a tooth. Of course, a dental implant is much better than a failing or ailing tooth. So yeah, there are specific situations where we might place dental implants to help improve a patient's cosmetics. But we have congenitally missing teeth situations, and we have certain situations that we might explore the use of dental implants.
What is a mini dental implant?
Well, typically a mini dental implant is basically a narrow diameter implant, much smaller than a regular diameter implant. And sometimes it's not utilized in every case, but there are certain cases where we might choose a mini dental implant instead of a regular diameter implant. The prognosis is not quite as good with a mini dental implant, but they're often a good choice for under a denture. They are a less costly option and less invasive procedure, but not chosen, for every case. Most of the time it's utilized in conjunction with a removable prosthesis, like a denture fitting over dental implants. So, but I don't want to give the misconception that, oh, this is something less expensive and less invasive, and therefore why not choose that? It's really very, once again, specific indications for use of that.
Are dentures an old-fashioned remedy for dental issues, or have they also developed new technology at this time?
Well, I guess we could say, dentures, maybe we could think of it as an old-fashioned thing because they've been around forever and ever. However, thousands of dentures are still made every year. There are, we take a sampling across the country, there are just thousands of people getting dentures. And that's maybe because of a number of reasons, cost or medical status. They can't have a more advanced type of procedure. But in general, dentures can lead to more bone loss for patients, and that's what we're concerned about. A denture, we have to remember, a denture rests on top of whatever's there, on the bone or gum, and it promotes further bone loss for patients. So it's not the first choice in most situations, but it's by no means a dinosaur of a procedure.
Tell our viewers what it was like for your practice and that of your colleagues locally and nationally when COVID-19 hit March of last year. What impact did it have on you?
Well, initially a lot of fear, and I'm sure you experienced that too. Just the how to manage, treating patients with COVID and that sort of thing was a very traumatic event for most dentists, I'd say. But it seemed like we quickly got the hang of it. We kind of learned how to manage, And the big issue was in the area of aerosols. Um, Typically, dentists have always been very well trained in infection control. I feel like since the 1980s, when the AIDS epidemic arose, dentists really amped up their knowledge of infection control. But most of that was in terms of bloodborne pathogens. Um, so dentists are very experienced at managing bloodborne pathogens. Now with COVID, with aerosols, there was a whole new ball game. And so a lot of us have implemented, air filtration devices in the office and, higher level masking, N95s and so forth. And so that's one area that is, what's going on with COVID. But maybe the other area is what's happening with patients with COVID. And this is really interesting, is that I myself, and I think most of my colleagues, have seen a huge demand for dental services since the vaccinations came out. And, naturally patients were less fearful and they started coming in. And so there was some just catching up on treatment that was there. And I'm sure you're seeing that in your own practice. There's some catching up, but I think there's been more of a problem in that patients being kind of locked down in their homes and kind of alterations of their entire lifestyle, their eating habits and showering habits and dressing habits and flossing habits and all of those things has led to, I've seen an enormous amount of tooth decay. I've seen other problems such as TMJ problems, which I would consider, say, stress-related dental problems, sort of broken teeth and fractured teeth. So I'm upset because the pandemic has left us with the long-term problems here, not just the actual direct COVID problems, but just in my world, it's I've seen a lot of patients have had bad results. On the good side, now that we're seeing patients again, we kid around with our patients that I can see those patients that have listened to us and learned from us over the years, because when they were locked down, there are a lot of patients that really did their flossing and brushing in their home care. So then when they came in to see us, we were like, wow, you're terrific. You don't even need us, So then there were others that really weren't good students, so it's been interesting. And
you mentioned a few moments ago that when the pandemic hit, there was understandably fear within the dental community, given your steady proximity to a patient with a potential risk of any of you being infected. Did you find, however, the converse was true as well, that patients were afraid that they might get the infection from the dentist or the staff?
Oh, absolutely. Yeah, absolutely. Patients were afraid to come to the dental office just because, they were afraid to be out, number one, but, knowing that, we have a lot of aerosols and so forth in the office, patients were afraid. But it seemed like once they came in and we communicated with them, they really seemed to relax. We have direct to mouth aerosol evacuation systems, and as soon as it seemed, we had a much reduced workflow, so it was sort of just one patient at a time, and very limited contact with patients in the office. So they really became comfortable very quickly. I think there are some patients out there that are still quite fearful. So, but in general, they really they felt comfortable in my office, at least. So, I can't speak for everyone, but
we are out of time. This has been a terrific conversation. If our viewers have any questions about dentistry, how can they reach you?
Well, they can email us. They can email me questions if they'd like at info@drsanker.com. That's just info@drsanker.com. Or they can call the office. They can take a look at our website, maybe to get some information, which is www.drsanker.com. So I'm always happy to answer questions for patients and so forth.
Thank you for joining us on Housecall, Robert.
Thank you so much. I appreciate. Good to see
My
you.
thanks to Dr. Robert Sanker for an excellent interview. My thanks to my team at the studio for making this show happen. And my thanks to you, the viewer, for joining us this evening. Tell us how we're doing. You can reach us at my practice website, montgomerygastro.com. See you then next time for another edition of Housecall. Good evening.